From mental health to life-saving medical trials, here's a look at health issues that impact kids and teens. I'm Christine Pae. Each week I report for Healthlink, a series on top medical issues, new advancements, and health trends you need to know about. Today I'm sharing some of our top stories this past year related to children's health. Haley Zaw is a senior at Shorewood High School in Shoreline.
I was born and raised in Singapore, and I moved here in December of 2021.
Among the things she noticed,
I'm used to the rain back home, so the rain doesn't really affect me as much, and I kind of like it.
It certainly wasn't the weather that dragged her down, but the daily stresses of high school life, tests, and college applications soon got to her.
When I first moved here, it definitely took a toll on my mental health because moving across the world, the earth actually, and the culture shock and the difference was, it really affected my mental health initially because I don't live with my parents. My parents live back home, so I live with family.
Haley looked for ways to help herself and her peers. She was chosen as one of 3 team leads for this year's National Student Advisory Council for a group called Work to Be Well, a group that advocates for teens to approach teens.
We're more likely to experience similar mental health problems or experiences, and we're able to relate and rely on each other.
The Providence Health-led group's goal is to encourage young people to embrace mental health.
It's the main part of what we do.
Joanza Hadley is the program director of Work to Be Well.
We make sure that everything that we do has a teen voice or a teen lens to it.
Now is the time to pay attention. Data from the CDC's Youth Risk Behavior Surveillance System shows an upward trend in mental health concerns among young people, including a steady rise in the percentage of teens who reported feeling persistent sadness and hopelessness. And the percentage of high schoolers who seriously considered suicide have ticked up in the last decade.
I think a lot of times, a lot of well-meaning, well-intentioned adults, are like, hey, we have this answer, we know what it is, but really it's about going to the teens who know, right? They're growing up today, they know what it's like to be in school.
And Haley wants to help uplift. As part of the program, she took part in a podcast about dealing with testing stress.
Hi everyone, my name is Haley. I'm a senior from Washington State.
And led a mental health workshop for teachers and staff at Shorewood High School. Her #1 message to teens:
they're not alone along this journey, and there's lots of people out there that love and care about them, and there's also lots of resources out there that they can access to help them, and that they'll be able to get through this, and you got this.
The hygiene hypothesis is a theory that suggests exposing children to pathogens early in life could help them gain immunity from infectious diseases, even protect them from developing asthma and allergies as they grow older.
The hygiene hypothesis is an idea, and it dates back more than 30 years now.
Dr. Joshua Liao is an internal medicine physician at UW Medicine.
So the idea is that an adequate exposure to certain organisms early on can help children's immune systems.
In our post-pandemic world, Dr. Liao says patients have brought this topic up.
Particularly after COVID, when so much attention got paid to hand washing and social distancing and masking and the like, and vaccinations, I just qualitatively, in my own experience, seeing people talk about this more.
The hypothesis adds overly clean and germless environments may hinder a child's immune system from developing properly and might be a reason why asthma and allergies have risen in recent decades. The CDC reports 1 in 4 U.S. children had a seasonal allergy, eczema, or food allergy in 2021. And Washington State has some of the highest asthma cases in the nation, with about 120,000 young people in Washington having asthma, according to data from the DOH.
The numbers of individuals and children that have asthma and allergies is rising in developed country over time. That's not in dispute. The issue is more that whether we can link that hypothesis to it.
Liao says there's no definitive answer and more research needs to be done.
There is a connection if you look at the evidence around it, but to me, it's not ironclad that it's related to the hypothesis leading to asthma and allergies.
Liao adds not all exposure to germs is bad and recommends parents should approach it with moderation.
Kids playing on the ground in public spaces. I think that's where you want to have hygiene for any number of reasons. What you don't want to have happen is people say, well, I want to clean my breast before breastfeeding. I should wash my mouth before I kiss my children. We're playing in a park and I need to hand sanitize, every 5-10 minutes. And so I would think about it that way.
Seattle Children's Therapeutics calls this the Cure Factory. On this floor, there are 9 separate clinical trials underway for pediatric cancer immunotherapy. Greta Oberhofer was only 3 months old when she was diagnosed with an aggressive form of leukemia. Her family tried everything, chemo and a bone marrow transplant.
During the transplant, she didn't fare very well. She became really sick.
But when the cancer returned after Greta's first birthday,
We were definitely at that point where it was either, hospice care or finding something revolutionary to try.
the Portland family turned to Seattle Children's for a revolutionary last resort, immunotherapy. On the 12th floor of Seattle Children's Cure building, and behind these windows is where the magic happens.
It's a floor that is set up to basically be a biofactory for making actual products for children that we are developing through our research programs.
Dr. Michael Jensen heads Seattle Children's Therapeutics. Their lead program genetically engineers the body's immune cells, basically teach them to attack cancer cells. Their focus, childhood cancers. And this month marks their 500th patient to be taking part in the treatment program.
Yeah, in the last 10 years, there's been an explosion in how we understand how the immune system and cancer interacts.
Immunotherapy works by educating T cells in the immune system to recognize cancer cells as bad and destroy them, just like how it would recognize an infection.
These T cells are reacting to the cancer like it is a flu virus, if you will, so they get very revved up.
Unlike chemo and radiation, which are notoriously difficult with long-term effects, the side effects of immunotherapy are flu-like symptoms. For Greta, it was a high fever.
It meant that the T cells were really aggressively attacking her cancer.
At the Cure Factory, T cells from a patient's blood sample are extracted and altered to get them to target those cancer cells. Seattle Children's is working with hospitals across the U.S. to conduct these clinical trials.
The child stays at their home hospital. The blood specimen is collected there. It basically gets shipped here. We make the product here, and then we freeze the product in suspended animation, if you will, and then the tubes of the product fly back to that hospital.
Greta was among the first patients to be part of Seattle Children's early trials. That was 9 years ago. Today, she is 10 years old and in the 4th grade.
Math is my favorite subject.
Her mother, grateful for the life-saving treatment.
So much has changed, and we just are so lucky that this worked for us.
If you'd like some more information on how to be a part of any of these clinical trials, head on over to seattlechildrens.org/therapeutics. Let's start with what melatonin is.
So melatonin is a naturally occurring hormone that's released by the pineal gland in the brain in response to decreased light.
Dr. Susanna Block is a pediatrician at Kaiser Permanente in Seattle.
So it's kind of our body's trigger to start to go to sleep. And that's something that we make ourselves.
The hormone maintains our circadian rhythms to help cue when it's time to sleep. Ever been jet lagged? Well, that's when your brain hasn't gotten used to changes in that rhythm. But there are synthetic forms of melatonin that you can take to mimic the interaction that makes the brain think it's dark and ready for sleepy time. It comes in the form of a tablet or a gummy. Dr. Block points out melatonin supplements are intended to regulate short-term sleep issues like jet lag. However,
there's a lot that we don't know about long-term or daily melatonin use, so it's not recommended to be used that way.
Increasingly, though, parents are giving melatonin to children as a sleep aid. Some are even marketed for kids. A study published in the Journal of the American Medical Association of Pediatrics last month found 6% of kids ages 1 to 4 and 18% of kids ages 5 to 9 are given melatonin by their parents as a sleep aid. This data was gathered from the parents of 993 children ages 1 through 14. Dr. Block says parents should be wary of giving it to their kids.
It's not intended for daily sleep aid for most neurotypical children.
Mostly because research is lacking on this. Block says rather than a quick fix of using supplements, she advises discussing any larger issues affecting their kids' sleep.
And so if you feel that your child is having sleep problems because of stress, depression, pervasive thoughts, that's really important to talk to them about that.
Adding to the concern, melatonin is not highly regulated by the FDA.
We don't always know that what is in the bottle is accurately reflected on the label.
Dr. Block says parents can turn to other ways to prep kids to fall asleep, like maintaining a dark, quiet room for sleeping and limiting screen time up to an hour before bed. From the looks of Renton High School, you might not think there'd be a fully operating medical clinic inside, but there is.
This doesn't replace a community provider's office, but it can complement and support that.
This school-based health center, as it's called, is one among 37 centers in King County elementary, middle, and high schools where students can get healthcare services for free in the comfort of their own school.
School-based health centers have a long history in King County and in the state of Washington.
Sarah Regal is a health administrator for Public Health Seattle and King County, the agency that oversees the centers.
The impetus behind all of that was thinking about how students need to be supported to be healthy and ready to learn.
Unlike a typical school nurse's office, where a nurse might tend to a student who feels sick or to administer prescriptions, these school-based health centers offer comprehensive care, such as well child exams and immunizations, sports physicals, confidential services like reproductive health and treating substance abuse, and mental health counseling.
A lot of our students really rely on us.
Physician assistant Kelsey Walsh has been working at school-based health centers for 6 years. She has seen the need for mental health services in particular grow during the pandemic.
So we have psychologists in each one of our school-based clinics, and they can talk to them about anything they need.
And first announced in March, King County, in partnership with the philanthropy The Balmer Group, are investing $2.4 million toward expanding mental health services at these clinics through 2025.
Coming out of the pandemic, we know that there are more kids, both young children and older adolescents, that are feeling higher rates of distress, depression, and anxiety.
The centers also provide much-needed convenience for working families.
So families don't have to take their kids out of school. Families don't have to leave work to take their kids to the doctor's office.
Todd Crooks remembers his son, Chad.
He was brilliant. He was funny. He was creative. And he had an incredible scientific mind.
Chad's creativity visible in his artwork, his zeal for science evident in his career goals.
His design was to be a mechanical engineering and get a job at NASA.
But in 2016, at 21 years old and struggling with schizophrenia, Chad Crooks ended his life.
While we were fortunate that he was willing to get treatment and do whatever it took to get better, he really lost hope.
Grieving, Todd and his wife Laura turned to solutions and explored preventative programs so that other parents don't go through the same thing. Their aha moment came while remembering an instance when Chad was in the ER.
The first thing that he said was, "Can you please tell my brothers and my sister that I'm just staying at my friend's house?" And he didn't even want his siblings to know that he was struggling with a mental health issue, even though we all knew it. And we realized in that moment that stigma was a big problem.
Todd also realized there was no mental health education in schools, and to reverse the stigma, Todd knew it needed to start in the classroom. His nonprofit organization, Chad's Legacy Project, was already raising awareness on mental health. He's now created a website, mentalhealthinstruction.org, an online library of study materials to teach kids the importance of mental health.
So it's kind of like taking all of those different programs and putting it on a silver platter for a teacher.
Todd believes physical and mental health should be integrated in education and should not just be a service. Teachers may access this online library for free. The process, cathartic for this father and more.
For me, this work has always been an apology. So it's hard for me to think about earning money from this.
And he says he knows his son Chad is watching.
I think he does know. Yeah. And I think he's proud.
Thanks for joining us today. To check out my most recent Healthlink report and get the latest health news, visit king5.com/healthlink.